Welcome to how PMS and PMDD are caused by toxins. And what I want to do with this video is basically have a blunt explanation of what's going on and why millions and millions and millions of women are suffering with symptoms that they shouldn't have to suffer with. There's no hype here about a special product. There's nothing that everyone should buy. I'm not going to put up fancy graphics and images. You're just getting a simple PowerPoint here. I just want to cut it back to basics and say this is why women have these symptoms, and this is how women are being manipulated into not getting well and spending lots of money on nonsense that is palliative at best. I'm going to go over 3 common misconceptions or things that just women are told about these problems. One is that it's a normal part of being a woman. The other is that it's hormonal. And finally, that conventional medicine can treat it. Now, in naturopathic school, I learned the basics of what causes PMS and PMDD, endometriosis, those things, and what to do to treat it. But then once I got into practice, women would often come in for one thing, and then it was kind of like, by the way, they have all these painful symptoms during their cycle, or they go into crazy mood swings and all that stuff. And their impression was that this was just something that was normal and something women had to go through. No, it's not something women should go through. A normal or healthy cycle should have some mild bleeding, and that should really be about it. If you start experiencing lots of other symptoms, it represents an underlying problem. The next misconception and the major understanding, not just among lay people, but among many professionals when it comes to PMS and other women's so-called hormonal symptoms, is that these symptoms are hormonal. And it almost sounds like a heresy to say that these symptoms are not caused by hormones. But if you step back far enough, it should be obvious that these are not caused by hormones, cannot be caused by hormones, and this hormonal explanation really doesn't lead anywhere. Because all it does is beg the question, if the hormones are off, why are they off? Now, I'm not going to say the hormones are fine. Yes, the hormones are dysregulated, but they're dysregulated for a reason. And the reason why women have these problems is not because the hormones are off, it's because of the stuff, the problems that are causing the hormones to be off. It's like if you get hit in the arm and have a black and blue mark and it hurts. You can say, oh, it hurts because I have a black and blue mark there, but doesn't it really hurt because of how you originally got hit? So we have problems, nutritional deficiencies, toxicities that dysregulate the hormones. One of the major differences between a conventional medicine approach and a truly natural and holistic approach is understanding that the body is intelligent and you want to work with the body's intelligence. If someone is promoting a natural treatment, but they just want to come up with some type of non-drug way to force something upon the body, that's still pretty much a conventional approach unless they have some type of understanding that the body is intelligent and you want to work with the body's intelligence. So if you have things that happen to your body which causes your body to respond by shifting its hormonal balance, then within the context of those challenges being presented to you, that hormonal shift is probably beneficial, actually. What you want to do is remove those problems so the body says, oh, I don't need to do this stuff with the hormones anymore, and your body will, for the most part, naturally shift the hormones back into balance. So let's jump right into toxicity, which is the number one reason why the hormones are off. We are living in a world that is, overwhelmed by toxins, whether it's just stuff you go out and breathe in the air, exhaust from cars, plastics, fillings from the teeth, fire and flame retardants, pesticides. I could go on and on with different toxins that we are bombarded against. When toxins come into the body, it has several mechanisms of dealing with it. The first is simply excretion. So, for example, if you ate bad food and then vomited up, the vomiting is actually a good thing. That's the body's way of saying, this is bad. I want to get rid of it. You don't have a vomiting problem, you have a food poisoning problem. So generally speaking, toxins come in, the body tries to eliminate it. I mean, once it gets in out of the digestive tract, through the liver and the kidneys. So the liver, more fat-soluble toxins, the kidneys, water-soluble, the lungs will breathe out carbon dioxide, and those are the types of toxins. If those major routes of elimination are overwhelmed, the body is going to start to look for secondary routes of elimination, possibly through the skin, acne, skin rash, eczema, that type of thing. Maybe there's inflammation around the mucous membranes around the throat, so there's a sore throat or sinusitis. That's a secondary attempt at elimination. That's not a sore throat problem. That's not a sinus problem. It's not a skin problem. It's a toxicity problem. The female body has another auxiliary route of elimination. It can bleed the toxins out. So what happens is, all this junk coming into the body, and the body says, well, I need to go do something with it. I don't want it to get deeper inside into my cells. So it starts to shove it into the reproductive areas, and then hopefully it just is bled out that time of the month. This could all be looked at from a biochemical perspective about how certain toxins, stress-specific liver detoxification pathways, and how excess estrogen also has to be detoxified through the liver, and if there are too many toxins, that excess estrogen isn't going to be eliminated. But really, this basic philosophical idea, the body is intelligent, it's trying to deal with toxins. If it can't get it out through the primary route, it's going to go to the secondary routes. That will really get people further along in understanding what's happening than a lot of this reductionistic biochemistry. A lot of times in health, people are fleeing out this biochemistry or these pathways or these chemicals, hormones, that's so narrow-minded it's not very useful. But for some reason, as soon as you start talking about some enzyme, or some chemical or some hormone, all of a sudden it's supposed to be understood as scientific, when maybe it's scientific, but maybe it's too reductionistic to really understand what's happening. Besides the female body using its cycle as an auxiliary route of elimination, we have to look at the types of toxins people are exposed to. And some of the major ones are, like, say, plastics with bisphenol A in it. Major hormonal mimicker. These are xenoestrogens. These are things that look like estrogen, except they are much, much stronger. And we're basically inundating our bodies with this. Women and men alike. You're drinking water out of a plastic bottle. You're basically giving yourself hormonal replacement therapy. Well, so a lot of the pesticides that they'll throw on foods, if you start looking up these things, they're estrogenic as well. So you go out, you think you're trying to be healthy, you buy some grapes, you're eating grapes full of pesticides, you're on hormonal replacement therapy. So this is what's dysregulating the hormonal system. It's not your hormones are off for no reason. It's some mystery. You have to take some drug or supplement that's going to force your hormones this way or that way. You're being poisoned. So this is basically what's going on. We are all toxic. We are in a toxic world. We are being inundated by these toxins. The toxins will start to accumulate in our bodies. What cannot easily be excreted will go into storage. That's why people get these polyps and these cysts in different places. Then later on, they can go into tissues and lead to autoimmunity and cancers, which are from toxicity. No one is studying the accumulative effect of all of these different toxins. There might be some bad studies out there that make it look like it's safe to have glyphosate or other stuff that's dumped into the environment, and then years later you learn, glyphosate is bad, or years later after they released it, it's like DDT is bad. What happened with DDT, how they release it, expose it to everyone, put it all over the environment, then they say it's bad, then they do again with other chemicals, and now with other pesticides, then you see the same thing with glyphosate now, where in countries they want to eliminate it because they realize that it's all toxic. It's just with one pesticide after another. It's a revolving door. And then it's like the plastics, BPA, you learn is bad. So then next thing you know, you have an whole industry of BPA-free plastic this and other BPA-free plastics. But do these BPA-free plastics have other toxins in them which are bad, which are estrogenic? I mean, who's looking at this whole thing? These toxins come in, they bioaccumulate. The body flips out and says, I need to get rid of it. And then you start getting detoxification responses. Your period that's too heavy, that's causing cramps, that's causing mood swings, that is your body doing its best to try to get rid of the toxins. So then you go to the medical doctor who has no training in toxicity, none at all whatsoever, essentially, except for like some really severe acute cases, but they don't teach in medical school about the cumulative effects of these things on the body. They don't teach about environmental toxicity in a meaningful way, in a way that's relevant to the average person who's just being slowly poisoned from the environment. So the medical doctor looks at this and says, oh, your hormones are off. Why don't you take some birth control pills to balance your hormones? Like, does this make sense? Like, women are being played. They are being given poisonous birth control pills in order to mask the symptoms of poisons that are coming in from the environment. A quick note about birth control pills. A healthy woman of reproductive age is fertile. If you give someone who is fertile an agent which causes them to be infertile, that is not balancing hormones. That's not enhancing health. That is giving them a poisonous agent. I'm not going to comment here and stand against birth control pills, but if women are going to use birth control pills, they should be honest about what they are putting in their bodies. Birth control pills are a lifestyle decision because you don't want to get pregnant. Birth control pills are not a health treatment. So if you're taking birth control pills for birth control, fine, that's your lifestyle decision, and you have to balance that with any type of health consequences. However, if you are taking birth control pills to so-called balance your hormones or for some health issue, you really need to seriously look deeper at what's going on, and maybe there is a better answer than taking something that artificially manipulates hormones. I'm going to talk about a couple of common nutritional deficiencies which are relevant in these cases. The first is iodine. Women need more iodine, as iodine is primarily used by the ovaries, breast tissue, thyroid, salivary glands, and other areas of the body as well. But because of the demand for it in terms of the breast tissue and ovaries, women have a higher need. Online, you can find lots of different opinions on how much iodine people should take, varying from microgram doses to high milligram doses, such as 12.5 milligrams or 13.6 or higher. Generally, I've seen good results with around 500 micrograms, but that's a case-by-case issue. And also, if there's a thyroid problem, such as autoimmune thyroid disease, you might want to be careful about iodine because you don't want to suddenly take a lot of it and potentiate an immune system response. But iodine is one of those common nutritional deficiencies that I work on addressing when I'm helping women with these problems. Other is fatty acids. A lot is made out of fish oil, and there are many people taking a lot of fish oil. However, often for especially PMS, and we see cases like dry skin or acne, you mix those together, often I find the healthy omega-6s are needed. So there are some omega-6s, such as in grain-fed beef, that are definitely pro-inflammatory, but there are also a whole slew of good anti-inflammatory omega-6s that we can get from vegetarian sources such as borage oil or evening primrose oil. And I definitely see fatty acid need, especially omega-6s, as important. And then there are going to be vitamin and minerals that help, such as magnesium or vitamin B6. I don't have a set protocol. If I did, I would just put that online. But these are some common things that I see, and then it's about individualizing when someone comes in, what does this individual person need? But in terms of supplements, these are the big ones. For detoxification, you want to try to practice avoidance. You don't want to drink out of plastic water bottles. You don't want to breathe in toxic fumes or drink toxic water. But considering how many toxins are in the environment, how you could just walk outside in the street and start breathing in car exhaust fumes, or you buy new clothes or carpet and you're exposed to flame retardants, and even if you don't buy it, you're going to be exposed to those things wherever you go outside. It's not realistic to expect someone to completely practice avoidance. So you want to practice detoxification. Some things that I commonly use are herbs, and I'm not going to lay out the best herbs for PMS, PMDD, because I don't know if there are best herbs for everyone, because even great herb isn't going to work on everyone. Herbs work on the general constitution of the body. For example, if someone is hot, cleavers or bedstraw is a cooling herb that can help balance them. Likewise, if someone's very cold, marigold is a good herb to warm them up. But herbs have different constitutional effects, not just on temperature, but on blood flow, on fluid balance. They have different organ affinities. So basically, if I'm working with someone, I try to look at the whole person and give them what they need, as opposed to just ranting off a list of, oh, you have this disease, so use these herbs for that disease. And that's the difference between working with a practitioner or just going out to a health food store looking online for a formula for PMS. Although there are lots of general good herbs for detoxification, so just taking a very basic approach should be able to help you even. Other things that can be used are nutritional supplements. Now, it's very easy to just rant off a long list of nutritional supplements for whatever, PMS, fibroids, PMDD, whatever you want to name it. And I can do that right now. We could say, well, NAC, alpha lipoic acid, DIM, or indole-3-carbinol, vitamin B6. What about some antioxidants? Even take glutathione, curcumin may help for some people. It seems like everyone today is taking curcumin. And I could add more to that list. What I really don't want people to do is just accumulate this huge list of supplements from the internet and go out and buy them all, because what you end up happening from that is someone who wakes up in the morning and they take 6, 7, 8, whatever crazy amount of different nutritional supplements, and it might be helpful, but it's probably not the most efficient way of working on the problem. And if they start adding in herbs or homeopathics, unless those are very specific ones for them, what happens is they just end up taking a lot, because all those supplements are working in a very general way, but none of them may be specifically for what they have or their body, or it might not be a high enough quality. And when it comes to herbal medicine, it's not just the herb you're taking, it's the quality. If you get from a very high quality manufacturer, you're going to get something that's much more potent than if you just run into whatever GNC or a health food store and buy whatever bottles laying around there. So having some type of individualized plan based upon case history, constitutional signs, and then testing. I do applied kinesiology in my office. That's a muscles testing technique to assess what organ systems are weak and what type of herbs and supplements may help those specific areas, or what type of toxins they're susceptible against. There's also functional labs that I would do at time and other practitioners would do. For a hair analysis could be used for toxicity. There's also porphyrin tests for toxicity. And there are other tests that could be used to assess toxicity levels. Usually I try to keep it simple in cases like PMS, because we know that there's a toxicity problem causing decreased estrogen. But the point is, if you take this more individualized approach, seeking to find out exactly what your body needs, in the long run, you might not just have something that's more effective, but it'll probably be more easier and get you truly well, as opposed to what goes on too many times is people take a lot of supplements, which are helping them, and they're better off taking those supplements than doing nothing at all, but they're such general non-specific supplements that they're taking because they heard it's good for PMS or whatever illness, and it's not exactly what they need, that they're taking a lot of stuff, and there's probably a core issue that they're missing. Okay, so that's it. I hope this presentation has been helpful. Okay, bye.